Am I a candidate for an inner thigh lift? Man, I gotta tell you that I'm doing more and more of inner thigh lifts than I ever expected. This whole trend for weight loss, and people are losing all this weight on these peptides, we're getting all this skin laxity. The inner thigh has become more of a concern for a lot of women. Even with women who need a little bit fuller thighs, they want less of that thigh gap. They want to do liposuction, but the reality is they have some stretch marks in their inner thighs, and they don't. If you do liposuction there in that setting, that laxity will get worse. I guarantee you will get worse. And then you also have the increased risk of having these contour regulators, dents, and it looks terrible. Back to like reasons why we remove skin. The reason we remove skin is you have skin laxity, and then doing liposuction makes things worse. You really want to remove that skin. So when we do an inner thigh lift, you're going to have a couple options typically. And so the first option is called a Crescent inner thigh lift. And so that incision is concealed in the panty line. And with that incision, I remove just basically a lift piece of skin in the upper inner thighs and lift it up. And so you get a much smoother, tighter contour of the inner thigh, and you have less of that thigh gap and less of that, rubbing of the inner thighs. And I think a lot of women are great candidates for that. For women who've lost a lot of weight, we're talking, significant amount of weight. We're talking about 30, 50 pounds or even more. Then what happens, you get, your weight basically wearing a big skin suit, right? And so your thighs are part of that suit, have all this extra skin. You have extra skin from the groin all the way down to your knees. And so that all that skin has to go somewhere. And so what we do is called a vertical inner thigh lift. And that's an incision that goes from your groin all the way down like a pant seam, all the way down to your thighs. And with that, I'm able to take all the skin of that thigh and close it by removing a piece of skin in the middle. And your resultant scar is going to be a thigh seam, like a pant seam scar, and that goes up into your groin. Very powerful procedure. That contour is dramatically better than a Crescent or thigh lift, but it really comes down to indications. You got to make sure your patients have the right indications and skin laxity, where that skin laxity is, where that skin needs to be removed, and whether or not they're candidate for a vertical thigh lift or the Crescent thigh lift. So anyway, hope I explained that well enough too. Don't forget, like and subscribe. Love to hear these questions. Keep sending them over. I appreciate it. And don't forget, stay tuned for more.